Welcome back, Chronics, and thanks for joining me. Today I'm sharing with you what I take for medications. These medications have managed my symptoms better than anything else. I basically just got this regimen together a couple months ago, and now I'm feeling pretty good. All of these symptoms, although not curable, are manageable. Nothing's private or personal in my life anymore, but that's fine. As long as I'm helping others, I am an open book. First up, we got the head meds. Been on these since I was 12 when they diagnosed me with fibromyalgia, which I did not have, and antidepressants are the treatment. So I've basically been switching them up my whole life. The Prozac and the Wellbutrin seem to work best together and have the least amount of side effects. Because, it's hard when something's wrong. You know something's wrong, you tell someone something's wrong, and they're like, nothing's wrong. Gonna need meds for that, like a lot of them. When I started the Adderall, I had more energy. Obviously, I could concentrate more. Why I probably have the extra added energy is because Adderall is a vasoconstrictor. So that means it constricts your vessels, like compression. That's why that helped me in more ways than one. Then we have POTS. POTS can be medicated with more than one medication. And many of you are already on medications when you could be better off on other medications because studies have been done and printed in medical journals. For POTS, going on Ivabridine, which is the generic form of the drug Chromolyn. It's been life-changing. I'm also on Mestinon, which also is life-changing. But those two together, what a duo. I mean, really. And then for MCAS, which I just recently found out I had started on the cholesterol, just shot in the dark because I seem to have a lot of bile acid hanging around. Come to find out, cholesterol can help treat mast cell activation disorder because it acts like the cleanup crew when things aren't digested in your colon, and it doesn't feel good if it's left chilling there with histamine production. Cholesterol helped, but not enough. It wasn't until I added in the sodium Chromolyn that my stomach problems resolved themselves. I also started antihistamines as well, like over-the-counter ones. And the drug Ketotifen, which is specifically for mast cells, it also comes in eye drops, which I do during the day. And then I take the Motegrity for intestinal movement that I am lacking. And it does help. Not fully, but it's a start. So yeah, it's a lot. Could I probably start my own private pharmacy? Absolutely. People will say, oh, is it so annoying, like having to take all those pills? No, because what's more annoying is the symptoms. So luckily, this combination really seems to be helping. These medications have given me a new lease on life, along with some supplements, which I think also can help. The difference I've noticed being put on some of these additional medications has been staggering. Shocked, surprised, also elated, because there is help, and you can have it too. As always, thank you for joining me, Chronics, and remember, stay strong, hang in there, and don't take crap from anyone. I will talk to you next time.